Thank you for participating in the Frontier NA1 stroke study. The aim of this study is to determine the efficacy of NA1 in reducing global disability in patients with acute stroke. In this video, we'll provide an overview of the steps you'll need to go through in order to enroll your patient in the study. Using the standard level of care and management, your first step will be to assess whether your patient is having a cerebrovascular accident. Once you've determined that your patient has suffered a CVA, you'll need to check whether he or she meets your local stroke protocol's criteria for bypass. When your patient is ready, confirm the time to transport to the closest designated stroke center. You can now start an IV using best practices and aseptic techniques. As with any infusion, and if possible, choose an IV site that will allow for an IV catheter of 20 gauge or higher.
Okay.
Call the trial number and discuss your patient's eligibility with the trial MD.
45-year-old male patient currently on scene.
Confirm the dosage using the dosage chart provided and ensure you provide all the vital signs with a history, as well as your patient's weight and LAM score.
That's correct. So I have the dosing chart in front of me. I'd like to go through it with you, please.
The study trial physician will assess the paramedic to reduce the stroke mimics.
I've gone through the exclusion criteria.
Remove the drug vial from the designated storage fridge. Examine the solution in the vial to ensure it's clear and free from precipitate. Discard if the solution is cloudy. Examine it carefully to ensure it's intact, has not expired, and that the warm mark tag is not red or does not read prolonged. If the warm mark reads mild or moderate, the drug can still be used. If the warm mark tag has started to turn red or does read prolonged, do not use it. Using the best practices and aseptic technique, drop the accurate dosage of the trial drug that has been ordered into the provided 20 cc syringe.
The expiry date is good.
Introduce the medication you've drawn up into the 50 milliliter mini bag provided using best practices and aseptic techniques. It will help to ensure even distribution. Now you're ready to set up the infusion pump, prime the line, and attach the NA1. To install the tubing, snap off the tab on the insert and discard. Lift the pump door at the top of the device. Align the IV set from the front and insert the yellow guide in the left slot near the sticker marked Patient with arrows. The blue guide goes into the right slot. Make sure you align the tubing to run straight down. Fully close the pump door and ensure it latches securely on the top left of the pump. Attach the IV infusion set to the saline mini bag using the integrated bag spike and hang the mini bag with the drug to be infused. To prepare for delivering the dose, press the on-off button on the pump and let the screen cycle through until it shows Library. Press Yes, Enter, and wait until the screen cycles through to show Repeat RX. Press Yes, Enter a second time and wait until the screen shows Run, No, Options, or Prime. Press Run, Pause. Wait until the drug reaches the distal tubing and starts to come out of the line, then connect it to your patient's line, ensuring the clamp is open on his or her side of the lock. Place the study bracelet onto the patient's wrist as soon as the study drug starts to infuse. Wait 10 minutes for the full infusion to be complete, and the program is either finished or the bag is empty and the pump is showing the air in line alarm. Press Run Pause and wait until the screen cycles through to show Repeat RX. Then press the on-off button to shut down the pump. You have now successfully enrolled your patient into this study. Please ensure that you record the amount of study drug in milliliters infused, including the time you start and stop the infusion. The paramedic should also record the randomization number on the ACR. If an adverse event takes place, it should be documented on your ACR in detail. Once the call has been completed, place the empty study drug vial back into the case provided along with the infusion pump. Do not discard the vial. Once the patient has been transferred, the paramedic should give the Frontier chart insert to the attending physician or nurse. Ensure your patient meets your local stroke protocol's eligibility requirements for stroke bypass. Start an IV in order to make your patient eligible for the trial. Call the trial number and speak to the on-call trial physician. Make sure to provide the physician a thorough history of vital signs, weight, and LAMB score for your patient. Carefully examine the war mark tag on the vial along with your standard drug check. Mix and squeeze the mini bag with the added medication to ensure proper distribution. When inserting the IV set and using the infusion pump, follow all the proper steps. Always use aseptic techniques and best practices for all procedures. Thank you for taking the time to learn how you can participate in this trial.